Hello and welcome to Aviation 101 with Laura. I am excited to say we have another listener.io sponsored video, and this one we're going to talk about common medical issues that I see in students coming to begin their flight training. So let's unpack a few of those and take a peek at what listener.io offers. The first thing that we see with common medical issues, three things I want to talk about. We have surgery, prior hospitalizations. Sometimes this is not a big deal. My husband has some gastrointestinal history of surgery, and it wasn't hard for him to get a medical because he gave the medical examiner proper documentation, and it was determined that that was not an issue for him to get his medical. But sometimes prior surgery, we had another student who got a sinus infection that proceeded to go to his brain. It was extremely rare. He ended up having brain surgery and he was all right, but he lost his medical. And so depending on what it is and the history, there may be a long process to get your medical, or you may not be able to get a medical at all. Secondly, we have substance abuse. Now, if you've had prior convictions of substance abuse, don't fret over this. It can be a thing that you can still get a medical, but it may take you a while to get the medical. One thing I would say with both the surgery prior hospitalizations and the substance abuse prior convictions for like DUI, DWI, things like that, I recommend consider subscribing to Aircraft Owners and Pilots Association as a member, and consider subscribing to their pilot services where you can get an extra level of help in getting your medical. It is not that expensive, and it may be able to help you. They may be able to help you. They have experts who can help get you a medical and advocate with the FAA on your behalf. So I recommend looking into that. Again, it's not insurmountable, but it may require additional visits and providers that have to do extra evaluation before you get a medical. Third, let's talk about mental illness just for a bit. PTSD diagnosis, diagnosed of depression. There are some limited medications that are approved for pilots to take while flying that have to do with helping prevent depression, helping prevent anxiety. I am not a doctor, not giving medical advice here, but once again, if you have a history of these things, you do need to be prepared for the medical process to take months or even years in order to get the medical. So do not wait until you are ready to begin flying and then expect this to happen quickly. I also want to mention emotional support animals. Now, it might be that you have a dog, cat, feathery friend that you really, little fluffy guy that you really want to bring, say, for example, to college with you, and you get a doctor to sign a paper that says, sure, this is an emotional support animal, and it's mainly because you want your animal with you on airliners or in the dorm at college. The deal is, though, if the FAA If you have an emotional support animal, the FAA says that's a diagnosed mental illness, not necessarily mental illness, but it's something that you have to report on your MedXPress form when you fill that out, and it is going to require some extra evaluation. So if you're thinking about getting an emotional support animal diagnosis just for the reason of having your animal around, and you're also planning to fly, I would really reconsider that. Now let's talk about counseling visits. The FAA guide for medical examiners specifically says that counseling visits are not to be reported on line 19 of the form unless they have to do with substance abuse or result in a diagnosis. Now, so I want to just unpack this. So if you need help as a pilot or a potential pilot, who should you talk to that you can make sure that you can seek support with complete peace of mind? That brings me to our sponsor of today's video, and that is from listener.io. I am excited about this sponsorship that they're giving me because they clearly have the ability for you to seek support from them without having to worry about reporting visits. And even more cool, it's online. It's one-on-one session. You can use Zoom or Discord. You do not have to use a camera. Let me quickly just show you guys really briefly on their website. If you click on About, you will see they have a specific area for pilots. And right here it says that because their counselors don't issue prescriptions, don't diagnose conditions, and are not licensed health professionals, that means if you meet with a listener counselor about anything besides substance abuse or a psychiatric condition, you don't report it to the FAA on line 19 of your MedXpress form. So that's really cool. And if you do want to subscribe and check it out, do a session with listener, you can even use code Laura for 50% off your first session. So I would encourage you, if you need counseling and you're thinking about flying or you're already a pilot, this is an awesome way to do that. Some other common medical issues that I see among students is these ones. We have color vision deficiency. That one has come up quite a bit with especially males, who are actually more prevalent in males to have color vision deficiency, but they can't see the numbers when they go to their eye exam or medical exam. They can't see the colored circles with numbers in them. So this is fairly common, and we've actually had a few students just go, basically you have to make an appointment, they go to the FAA, they demonstrate that they can see color vision adequately through a light gun signal test. And several students I know have done this. And then they got on their medical a statement of demonstrated ability, or a SOTA for short. And then, even cooler, when they go back to get a medical next time, the examiner does not actually even show you the color vision test because you've already demonstrated to the FAA inspector that you have adequate color vision. Now, it's possible to fail the test, and then that can prevent you from flying at night. For example, we had a student who could not fly at night because of this deficiency. However, it doesn't completely keep you from flying. It just depends on what you're trying to do. ADD, ADHD medication use. Now, the FAA just introduced recently a fast track method. If you haven't used medication for ADD or ADHD in the last 4 years, and you are able to function without that medication, or let's say you're thinking about flying in the future and it's possible to stop using those medications, then you may want to consider that. Consult with your medical professional, of course, but if you can demonstrate with documentation, there's a whole checklist on the FAA website, and I have another video about that. I'll link to that in the video description. But you can go ahead and get a fast track medical if you have not used ADD, ADHD medicine in the last 4 years. If you have, again, there's a process. We've had several students go through it, and several are flying for Southwest Airlines right now. But it's just something to be aware of. It is going to take longer to get your medical. And lastly, just as a point of advice before going to your medical appointment, go get an eye exam. If you're not sure if you need a new prescription, or you don't know if you need a prescription at all, go get an eye exam before. That way you'll find out. And if you need a prescription or you have glasses, which I wear contacts, go to your medical exam with the aviation medical examiner with your glasses or your contacts, because you're going to be evaluated on your vision. So thanks again to Listener for sponsoring this video. Listener is an awesome option that lets pilots seek counseling support with complete peace of mind. And don't forget, if you check them out, to use my code, my name, Laura, for 50% off your first session. Have a good day.